Hello, I am Kathy Thatcher and I will present a community assessment addressing infant mortality among Tongan women in Utah. The report will review Tongan history and present a health background as it relates to their nutrition and lifestyle behaviors. It will review aspects of maternal health, including obesity, and it will look at reasons why this specific islander population might not seek prenatal care. It will look at current and recent interventions and conclude with recommendations to reduce infant mortality and improve fetal outcome. The assessment focuses on Tongans, who make up the largest percentage of Pacific Islanders in Utah. Therefore, in much of the data, they will be referred to as Pacific Islanders. Utah is home to 1 in 4 Tongans, the second highest state population next to California. With respect for their cultural heritage, they bond together in family and faith. Nearly 25% of Utah's Pacific Islanders live in poverty. In the city of West Valley, where reside 23%, annual average income for adults without a college education is $31,000. The majority of Utah's Tongans and Samoans work within the service sector, and many of them belong to a family business that provides unskilled labor. Bringing home a modest income may be the reason why many are uninsured and unable to access health care. In Utah, the general Pacific Islander population has an obesity rate of 82%, wherein is seen a 60% rate of type 2 diabetes. Adolescent obesity is 33%, and one theory behind the larger body type is a genetic trait that promoted the storage of fat and energy during historical periods of feast or famine. Also, obesity may even be a cultural preference. Today, their traditional high-starch diet coupled with America's high-sugar, high-saturated fat diet found in fast and convenient foods, set them up for obesity and a soaring rate of diabetes. Unlike in Tonga, physical labor is not required to obtain their food. As a result, food is abundant, and for some, physical activity is put on hold. As there is a high prevalence of physical inactivity in this population, they are more subject to higher BMI, higher blood pressure, cholesterol, and blood sugars. The infant mortality rate is 10.5. That is 10.5 births per 1,000 births. This is compared to the state's 4.9. In the next slides, you will see why infant mortality is a concern. Within the Pacific Islander population, obesity is the biggest nutritional problem among females of childbearing age and contributes to infant mortality. Pacific Islanders' maternal obesity rate is 52%. Obesity leads to diabetes among the general Tongan population and gestational diabetes among pregnant Tongan women. Most women who have gestational diabetes deliver healthy babies if the diabetes is managed. However, complications put their baby at risk for excessive birth weight. Subsequently, the doctor may recommend delivering a large baby before the due date and before the infant is developmentally ready to live outside the womb. In addition, these babies often run a low blood sugar because their own insulin production has been too high to manage the elevated glucoses of the placental blood. Tongans value the family, and their cultural and religious beliefs encourage children, which impact the spacing of children and the consequence improper spacing has on infant mortality. Prenatal care is health care for the pregnant woman. The graph shows Pacific Islander babies born in Utah and the amount that have early prenatal care, 42%. Prenatal care can prevent the majority of problems that cause infant mortality, but what are the barriers? The Institute of Medicine outlined several determinants to prenatal care involving sociodemographics. Studies show that low education, unmarried status, young age, and high parity are associated with delayed prenatal care. Women without private insurance and coming from high-risk demographics are more likely to delay care. Some women may consider pregnancy a natural process, which needs no preventative care. Women with unintended pregnancies may not recognize their pregnancy until later in gestation, or they may be in denial and place low priority on seeking timely care. Analyzing and interpreting the risk factors for infant mortality requires a broad look at environmental, economic, social, and biological impact. The socio-ecological model might help us understand how determinants of obesity relate to Tongan women. The model believes that obesity is determined by more than the unmodifiable genetic factors of ethnicity, race, gender, biological and physical traits. Obesity stems from lifestyle behaviors of the individual, the dietary habits and physical activity. Influences of the interpersonal relationships like family, culture, and peers shape one's attitude toward types and quantity of food and the desire to be active. The community determines the accessibility to healthy foods, safe neighborhoods for activity, and affordable recreational facilities. Government and state and county agencies make policies and allocate funding and access to medical insurance, prenatal care, food assistance, and health education. Women, infants, and children is the top referral. WIC does not provide prenatal care, but they offer prenatal advice and give nutritional information. Baby Your Baby as well offers dietary counseling and contains information for seeking prenatal care. But the program I want to focus on is the It Takes a Village program coordinated by the Utah Office of Health Disparities. The program is tailored to Tongans and Samoans, and it previously ran several sessions from 2016 to 18. The workshops were aimed at Pacific Islanders as a community, as a family, and as a culture. At each session, the project raised awareness and educated them about maternal and infant health in a culturally acceptable way. In the Community Assessment Report, you will find a list of the many resources available for the Pacific Islander population. Along the Wasatch Front, there are several free and low-cost clinics to serve the uninsured and underserved. There is now a Pacific Islander prenatal provider. Physicians are able to prescribe more than just medication and diagnostic exams. They can prescribe wellness to these patients, lifestyle behavior, nutritional counseling, and physical fitness through the Living Well program. If transportation is a problem, there is a good chance the wellness bus will visit your neighborhood sometime each week. SNAP offers food assistance, and the Downtown Farmers Market gives bonus dollars to SNAP recipients. How can we help Pacific Islanders appreciate the hiking trails in our beautiful mountains? The population I would like to address for nutritional intervention is the female adolescent population, who are the future mothers. The obesity rate in this population, as mentioned, is 33%. For adolescents, we need to build a community of support for Tongans of all ages. Adolescent care is preconception care. School health education should be lifestyle education. Arrange a dietitian to teach a class. Be active beyond the PE class, beyond the school day, and include adolescents in the It Takes a Village program. Teach them to build a healthy plate centered on the dietary guidelines about meals comprised of 50% fruits and vegetables, whole grains during the day, and minimize the fast foods and snack foods with the high sodium and fat. Luau's are the center of Pacific Islander life, but portion control is a must. One time through the line should be the norm. Try a bread-free meal. Make water the preferred beverage. The results of the community assessment suggest a need to expand community-based and preconception education programs that communicate the value of prenatal care, as well as family planning and other programs to reduce unintended childbearing. This suggests that efforts to communicate the value of prenatal care and to prevent unintended births are important directions for intervention and policy. Thank you.